The unspoken struggle mental health in America. Mental health is just as important as physical health, yet millions of Americans struggle in silence. They face anxiety, depression, and other mental health challenges. The numbers are alarming. A significant portion of the adult population experiences mental illness each year. Despite its prevalence, mental health remains a taboo topic. People hesitate to talk about it openly. This silence creates a sense of shame and isolation. It prevents individuals from seeking the help they deserve. The consequences of untreated mental illness are severe. They impact every aspect of a person's life. Work, relationships, and overall well-being suffer. The cost to society is immense, both in terms of human potential and economic burden. We must break the silence surrounding mental health. We need open conversations, increased awareness, and readily available support. It's time to prioritize mental well-being as a nation. The weight of stigma, a barrier to seeking help. Stigma is a powerful force. It creates a climate of fear and judgment around mental illness. People living with these conditions often internalize this stigma. They feel ashamed to admit they are struggling. This fear prevents them from reaching out for help. The media often portrays mental illness inaccurately. This perpetuates harmful stereotypes and misconceptions. It reinforces the idea that mental illness is a sign of weakness or instability. This couldn't be further from the truth. We must challenge stigma at every level. We need to change the narrative around mental health. Open and honest conversations are crucial. Sharing personal stories can help dismantle stereotypes and foster understanding. Education is key to combating stigma. By learning about mental health, we can develop empathy and compassion. This understanding will help create a supportive environment where people feel safe seeking help. A crisis of access. Navigating the mental health care maze. Access to mental health care is a significant challenge in the USA. Many people face barriers when trying to get the help they need. These barriers include high costs, limited insurance coverage, and a shortage of mental health professionals. Navigating the healthcare system can be daunting. Finding the right provider, understanding insurance coverage, and scheduling appointments can feel overwhelming. These obstacles often discourage individuals from seeking help altogether. Rural communities face unique challenges. There is a severe shortage of mental health providers in these areas. This lack of access forces individuals to travel long distances for care, which can be a significant burden. We need to make mental health care more accessible and affordable. Expanding insurance coverage, increasing the number of mental health professionals, and simplifying the healthcare system are crucial steps. The ripple effect. Mental health's impact on communities. Mental health issues don't just affect individuals. They have a ripple effect, impacting families, communities, and society. When individuals struggle, their families feel the strain. Relationships are tested, and loved ones often bear the brunt of emotional distress. The workplace is also affected. Mental health issues can lead to decreased productivity, absenteeism, and increased healthcare costs. This impacts businesses and the economy as a whole. Communities bear the weight of untreated mental illness. It contributes to homelessness, substance abuse, and crime. Addressing mental health needs is essential for creating safe and thriving communities. Investing in mental health is not just the right thing to do, it's the smart thing to do. It benefits individuals, families, communities, and society. By prioritizing mental well-being, we create a healthier and more prosperous future for all. Investing in hope. The need for increased funding. Addressing the mental health crisis requires significant investment. Increased funding is crucial for expanding access to care, supporting research, and raising awareness. Funding should be allocated to various initiatives and programs. Community mental health centers play a vital role in providing accessible and affordable care. Increased funding would allow these centers to expand their services and reach more people in need. Research is crucial for developing new treatments and improving existing ones. Public awareness campaigns are essential for combating stigma and promoting mental health literacy. Funding these campaigns would help educate the public and encourage help-seeking behavior. Investing in mental health is an investment in our future. By allocating adequate resources, we can create a system that supports individuals, families, and communities. Building bridges community support as a lifeline. Community support plays a vital role in mental well-being. Strong social connections, peer support groups, and community-based initiatives can provide a lifeline for those struggling. Feeling connected to others is essential for mental health. Support groups offer a safe and understanding environment for individuals to share their experiences and connect with others who understand. Community-based programs can provide a range of services, including early intervention, crisis support, and long-term care. Faith-based organizations can also play a crucial role. They often provide support, counseling, and a sense of community. Creating a network of support requires collaboration. Government agencies, healthcare providers, community organizations, and individuals must work together to build a system that supports mental well-being at every level. Knowledge is power. Education for understanding and empathy. Education is a powerful tool in the fight for mental health. By increasing mental health literacy, we can combat stigma, promote understanding, and empower individuals to seek help. Education should begin at a young age. Schools should incorporate mental health into their curricula. Teaching children about mental health equips them with the knowledge and skills to take care of their well-being. It also helps reduce stigma and fosters empathy. Adults can benefit from mental health education as well. Workshops, online resources, and community events can provide valuable information about mental illness, treatment options, and how to support loved ones. Increasing mental health literacy empowers individuals to recognize warning signs, seek help when needed, and provide support to others. It creates a more informed and compassionate society. A call for action: policy changes for lasting impact. Policy changes are essential for creating a mental health care system that works for everyone. We need policies that prioritize mental health, expand access to care, and address the social determinants of mental well-being. One crucial step is to ensure that mental health services are covered by insurance plans. This parity would remove a significant barrier to care and make treatment more affordable. We also need to increase the number of mental health professionals. This can be achieved through scholarships, loan forgiveness programs, and incentives for working in underserved areas. Addressing the social determinants of mental health is crucial. Factors such as poverty, discrimination, and lack of access to education and employment opportunities significantly impact mental well-being. By addressing these systemic issues, we can create a more equitable and just society that supports mental health for all. Towards a brighter tomorrow, embracing hope and healing. The state of mental health in America is a complex issue, but it's not without hope. By acknowledging the challenges, addressing stigma, increasing access to care, and advocating for policy changes, we can create a brighter future for millions. Recovery is possible. With the right support, individuals can live full and meaningful lives. We must embrace a message of hope and healing. Every individual deserves compassionate care and the opportunity to thrive. Let's work together to build a society that values mental health, supports those who are struggling, and celebrates the resilience of the human spirit.